This simulation introduces the surgical set used in a standard laparoscopic appendectomy. The 10 by 10 centimeters gauze swabs can be used to control bleeding. The tonsil swabs can be used to facilitate hemostasis. Any discarded sharps should be placed in sharps pad. A scratch pad is used to keep electrosurgical instruments clean of charred tissue or debris. A swab counting bag can be used for convenient counting, handling, and disposal of contaminated swabs. An anti-fogging agent should be applied directly onto the laparoscope lens to condense steam into larger droplets, so as not to obscure the camera view. The filter needles are used with the syringes to aspirate solutions. Gallipots are used as containers for liquids, as well as specimens and waste. Kidney dishes are used for the safe collection of medical waste. The laparoscope warmer is a sterile, single-use wrap that applies instant heat to warm scopes, preventing fog and condensation on the distal lens. The sterile camera cover should be placed around the camera attachment to maintain sterility. Wound dressings can be used to cover the trocar sites at the end of the procedure. Steri-strips are sterilized surgical tape, which can be used for wound closure. Size 1 absorbable braided sutures with J needles are used as stay sutures for the Hassan port. The size 4 to 0 monofilament. Bupivacaine 0, 25% with adrenaline 1:200, 000 is a local anesthetic and should be aspirated into the 20 milliliter syringe with the filter needle. This is used at the end of the surgery to create a transversus abdominis plane tap block. Lidocaine is a local anesthetic and should be aspirated into the syringe with the filter needle. This is used for infiltration at the trocar sites during skin closure. The number 15 blade has a small curved cutting edge, used to make short and precise incisions. This blade can be used to incise the skin and anterior fascia for port insertion. The blade must be placed into the blade holder, using forceps before use. The handheld diathermy, also known as electrocautery pen or monopolar, has cut and coagulate modes. Soft tissue can be cut using the heat generated from a high voltage output. Alternatively, small vessels can be cauterized using a lower voltage output. The handheld diathermy can also be used to incise the skin for port insertion. The Langenbeck retractor is a right-angled retractor, which can come in various sizes. This instrument is used to retract skin and subcutaneous tissue. 2 Langenbeck retractors can be used to expose the anterior fascia. Alice tissue forceps have teeth at the tips of the jaws to hold soft tissue. They're used to grasp the peritoneum on either side of the midline during its incision and during the placement of stay sutures. The curved Mayo scissors have curved blades, which are used for cutting heavy fascia or muscle, and it can be used to incise the anterior fascia. The needle holder should have ratchets to allow the instrument to lock the suture in its jaws. The jaws of a needle holder are short and crosshatched. The needle holder should grasp the needle on its body. All sutures are passed to the surgeon in needle holders. The Hassan port has a blunt tip and wings to anchor the stay sutures. The 30 degrees laparoscope, one of the more common types, uses an angled lens and is first inserted through the Hassan port. Typically, both 10 millimeters and 5 millimeters laparoscopes are available to allow repositioning. In contrast, the 0 degrees laparoscope provides a broader, panoramic view with its vertical lens. 2 5 millimeters trocars are used in this procedure. Larger trocars may be used depending on the surgeon's preference. The atraumatic graspers have serrated jaws. These graspers are used to handle soft tissue. The atraumatic fenestrated graspers are similar to the atraumatic graspers. They can be differentiated by the window along the length of the jaws. These graspers have a similar function to the atraumatic graspers and are used to handle soft tissue. The disposable hook has a right-angled tip. The hook can be used to cut or coagulate using different voltage outputs. This instrument is commonly used as the general dissection instrument in laparoscopic appendectomies. Another energy device can also be used as an optional instrument in this procedure, depending on the surgeon's preference to grasp, cut, dissect, and seal tissue in vessels. The laparoscopic clip applicator is used to introduce and close a clip around a vessel. This instrument can be used to ligate the appendiceal artery during mesoappendix dissection or to ligate the appendix at the base. Loops can be used to ligate the appendix at the base. The laparoscopic scissors are used to divide the appendix at the base between the loops. An overview of the Mayo table. Here a list of instruments named are given. Let's check it out. The suction irrigation cannula is connected to a suction pump and an irrigation solution. This instrument can be used to perform a wash. The specimen bag is enclosed within the cannula of this instrument and can be released once inside the abdominal cavity. It is inserted in the Hassan port in a 5mm laparoscope must be ready for insertion into a 5mm port. After the appendix is amputated, it is placed in the bag and removed. An overview of the back table. Here you can see all the instruments named one by one. An overview of a patient showcasing other equipment needed. If you found this content is helpful, then like and subscribe for more such content.